Chapter 39, Heart Health and Genetics, a specific training for the cardiovascular sensor. Now you will find this test here. It's called the cardiovascular sensor, and it's for cholesterol problems, elevated triglycerides, homocysteine, which is something similar to cholesterol. High levels promotes heart disease, atherosclerosis, and sudden cardiac arrest. And this test has three beneficial functions. One is it helps you prevent the disease if you have an increased risk. The second is it helps you diagnose it in time. And the third is it improves treatment if you have already developed it. So it is recommended for healthy people as well as people already suffering from heart disease or one of these problems. All right, genetics have a strong influence on a lot of factors for heart health. So for example, they can cause a predisposition to high LDL cholesterol. That's fat, type of fat in blood, and high LDL cholesterol. LDL is the bad cholesterol. Low HDL cholesterol is also bad, that's good cholesterol. And there are omega-3 fatty acids, which are in these fish oil capsules, for example. People take them because they hope that it improves the HDL cholesterol. And some people have a genetic variation where this is actually not beneficial, but the opposite, it actually makes it worse. Then there are high triglycerides, which are influenced by genetics. High homocysteine, as I said, this is a substance that is in blood. It's actually an amino acid that, if elevated, increases the risk of heart disease. And it can be lowered by certain substances like folic acid and B vitamins. And in some genetic types, it also is possible in vitamin B2, with vitamin B2 to improve homocysteine levels. But other genetic types don't get this positive effect. And then we also have the prolongation of the QT intervals. If you look at an electrocardiogram, this is, you might have seen it in ER series, this line that goes up and shows you the sign of a heartbeat. And there are certain regions in this heartbeat which are called the QT interval. And certain genetic variations cause some people to have a prolonged QT interval, which also has been linked to an increased risk of sudden cardiac death, heart attack. So we can also test for this, and certain drugs have also shown to prolong the QT interval, and then you need to be careful. And then we have 26 different drugs that are commonly used to treat heart disease or any of these factors, and we can estimate the function, the effect of each drug, and what the perfect dosage is, or if you should maybe avoid a drug because it might cause side effects in you. And this here is a long list of the genes. If this table doesn't mean anything to you, please do watch the training of simple disease risk statistics. I will just quickly summarize. This is the gene, this is the catalog number for the genetic variation in this gene, this is scientific blah blah, this is actually the genetic results, so GG, a G on each one of the genes. In this case we don't have an odds ratio, an increased risk of disease, because every one of them does cause a disease risk, but it's for different things. So one is for high LDL cholesterol, the other one is for sudden cardiac death. So we don't want to combine them because it would be scientifically incorrect. So that's why odds ratio will not have any numbers here. Responder means they respond particularly well to something, and risk means it's an increased risk for something. So again, watch the training for these kind of tables in case this doesn't mean anything to you. The same goes for this here. Just to summarize, this is the gene. GG genotype is 64% and 2.23% higher risk, so 123% higher risk for coronary heart disease in this case. Another gene, 30% of no risk, 50% of a 1.47 risk, and so on, and here's the science behind it. And this is a cutout from the report, so you can really look at every one of these genes in detail. The X shows what the actual result of this one person is, and it will help you look into the information. This is actually an interesting one. 96% have this genotype with no increased risk. However, 3% have an increased risk of coronary heart disease. a predisposition to low HDL cholesterol, that would be the good cholesterol, and a predisposition to elevated triglyceride levels. So really this genetic variation has a number of different effects. And yeah, that's how it goes on. 10% have an increased risk, 18% have no increased risk of disease, 76% have no increased risk, 1% have an increased risk for coronary heart disease, and so on. And here's a predisposition to elevated homocysteine levels, which is, as I said, one of these substances that are not good for heart health. And here's the interesting one with aspirin. If you have the TT genotype, 74% of the population, aspirin will protect against thrombosis. And in 24% the TC, aspirin provides no protection against thrombosis. So 26% of the population will not benefit from the thrombosis effect of aspirin. And this needs to be considered because there are some drugs, blood thinners, that entirely work on the action of aspirin. Here's the predisposition to good or bad HDL cholesterol levels and so on. And this here again is a cutout from the report. I'm going back a step. This here is very scientific. I wouldn't really explain it to customers. This is just a scientific blah blah, so scientists can check up of what we claim. This is what I would show to the customer or to the patient. For one thing, you see your general risk of coronary heart disease and so on. So this is the average risk, the risk that the general population has. This is a much higher risk, so this is the highest possible genetic risk. And it might also be here in the green area with a protection, meaning you have a lower risk than that of the general population. And this person has the arrow here, so it's an increased risk compared to everybody else. So prevention, early detection, and all of these preventive measures are very, very important for this person, much more than the general population. Okay, then the LDL cholesterol levels are likely to be increased. In this case, LDL is the bad cholesterol, and due to genetics, this person has a tendency to have higher LDL cholesterol. HDL cholesterol should be high, that's a good cholesterol, is in the middle, so they have some tendency to have slightly lower HDL cholesterol levels. Homocysteine are likely to be quite normal. Vitamin B2 will not help to reduce homocysteine levels. Omega-3, that's actually an important one. The omega-3 fatty acids, the fish oil capsules, will make the HDL cholesterol worse, not better. This is actually the same result that I personally have. So I would not recommend fish oil capsules to help them reduce or improve their HDL cholesterol, because it's bad for these people. Triglyceride levels are likely to be slightly increased, which is not so good, but not as bad as it could be. The effect of aspirin, there's no protection from thrombosis by aspirin, and the risk of sudden cardiac death, heart attack, is normal due to the genes that would prolong the QT intervals. So this is the information that we can gather from these 22 genetic variations. The next step, of course, is to help prevent these diseases or these problems to occur. And as I said, this test has a number of functions. For one, prevention of any of these problems to occur, early detection if they do occur, so we can really get treatment in time, and finally better treatment in case they have occurred. And let's look at each of these in turn. So for prevention, especially for people with high risk, it's important for them to improve their lifestyle. And that is, for one, regular exercise. This improves a number of blood parameters, including the cholesterols. Then people should not smoke. Smoking is not just a risk factor for lung cancer, but for a number of other diseases, including heart health. Drinking much alcohol is detrimental. You should drink little alcohol, and if you drink alcohol, wine in small amounts would be maybe beneficial, and anything stronger or larger amounts would be detrimental. A low-fat diet would be important. Less animal and more plant foods. So you have less animal fats and more plant oils because they are more positive. So vegetable oils would be better. And omega-3 fish oil capsules might be beneficial for some people, then we would recommend it, or they might be bad for some people, then we would not recommend them. And then the next step is early detection, which would mean regular medical blood tests. If you have an increased risk, you should really go to your doctor and keep doing a checkup more frequently and earlier to make sure that they're treated and are under medical supervision. Then you should, in case it is necessary, because your QT interval might be too long, to do regular QT interval tests and also measure the electrolyte levels when performing extreme sports. So your doctors will be able to keep an eye on each of these things and help you manage them and advise you to do them. That's what we would recommend. So if you're the doctor, that you could then do all of these tests to keep an eye on each of these factors, especially the ones where there's an increased risk. So we've got prevention and early detection. And the final thing is breakdown or better treatment. There is the training, in case you haven't seen it yet, of the pharmacosensor of how drugs are metabolized by the body, how some of them cause side effects, some of them might not have an effect at all. So I would really recommend you to watch that training as well. From there we know that certain drugs go through certain enzyme systems to be broken down. And if one of these enzyme systems has a genetic variation, a certain drug might not be broken down. If you then take it every day, then you might end up with the drug building up and causing severe side effects. So what we can do is create this kind of list, and you see the different types of substances. FDA here means it's a warning that the FDA in America has given that this drug is influenced by genetic variations and you should consider this. The effect in some cases is likely higher or normal. Breakdown might be slower. We don't have a good example here, but this drug here is broken down slightly slower than other drugs. It might even say 0%, so the breakdown of the drug is completely inhibited by genetic variations, in which case you would see here alternative is advisable, so go for a different drug if possible. And you will also see different dosages, so 100% is the normal dosage, 140 means you might even need more of the drug to have the same effect. Because the breakdown is also faster, so you need more to keep more in the body because the body would remove it faster. So here you can really get a whole list. Actually here we have a good example. Fluvastatin is breakdown only 21%, and that means you would only need 20% of the normal dose to have the same effect. And if possible, you should use an alternative drug. So this will help you choose the right drugs, choose the right concentration of the drug, the right dose, and improve the treatment of each of these drugs. So we've got prevention, early detection, and better treatment, all covered by this genetic test, meaning it's good for people or beneficial for people that don't have the disease yet or that already suffer from the disease and want to have better treatment. And that's the end of chapter 39, Heart Health and Genetics, and specific training for the cardiovascular sensor.